Hey everyone, it's Dr. Foley again. I want to go over something that we handle in our office quite a bit, which is diabetes type 2. And of course, diabetes type 2 is due to high sugar in the diet, like the standard American diet is high in carbs, low in fat, and that causes increased insulin. Insulin is a hormone that has to take the sugar and put it into the cells and burn it as energy. Causes, again, the standard American diet is the biggest cause. High in sugar, high in carbs. Now when I say the word carb, what that means is sugar and carbs are the same thing. So your increased carbs in your diet should not be over 75 grams of what they call net carbs. So you want to keep your carbohydrates 75 net carbs or below. Anything over 75 is sent to the liver, changed to triglycerides, and stored as fat. The average American is eating 400 to 500 carbs per day. No wonder we have a problem with diabetes type 2. Frequent eating is also a problem. You know, the snacking between meals, that started in the 70s to keep your metabolism level. It's only short-lived. It's not something you want to do all the time. A snack is a meal to the body. A small snack is still considered a meal, and it can push that sugar up. It is totally possible to reverse diabetes type 2. We do it in our office all the time. Here's a couple of tips. You have to clean up the liver. The liver holds a cup of sugar, and that has to get cleaned up. You have to eliminate sugar and foods that turn into sugar, like carbohydrates, which would be mainly grains. Those turn into sugar. You're going to have to eliminate those or reduce those considerably. Intermittent fasting, where you get up in the morning, you don't eat breakfast, and you only eat lunch. Or maybe you get up in the morning, you don't eat breakfast, you don't eat lunch, and you only eat until supper time. That's a water fast. Intermittent fasting is what you would do. Your glucose, your blood sugar, should be ideally optimally at 85, but it needs to be under 100. You can go get a glucose monitor. I recommend everybody have one of those. You can buy it at any drugstore, and you check your glucose, your sugar, first thing in the morning. Of course, that's through the blood, just like a diabetic would do. So you want that first thing in the morning, anywhere between 85 and 100. If it's over 100, that's usually a liver issue. Your liver's dumping out too much of that sugar at nighttime. Your A1C, now these are tests that you would find on a blood test. Your A1C should be as close to 5 as possible, and 5 would be optimal. Now a lot of times people come in, they're diabetic, they're on medication like metformin, and they say, well, I'll just eat more and I'll take more metformin. Well, I want to give you some side effects to what metformin has. One of them is nausea, vomiting, diarrhea, muscle weakness, metallic taste in the mouth. Some serious side effects would be an allergic reaction to metformin, rashes, itchiness in the face, tongue, and throat, severe dizziness, and trouble breathing. Well, what about insulin? I'll just take insulin. My body makes insulin. Yes, it's okay if your body makes the insulin to handle the sugar, but when you're shooting in insulin, either through a needle or through the pump, that's not the way the body takes insulin. So here's some side effects for the insulin. Sweating, dizziness, lightheadedness, shakiness, hunger, fast heart rate, tingling in the hands, feet, lips, and tongue, trouble concentrating or confusion, blurred vision, anxiety, irritability, mood changes. That's all from insulin. Long-term use of insulin, this is why we want to get people so they're no longer diabetes type 2. Long-term use of insulin increases the risk of cardiovascular events, heart attacks, heart disease, increases the risk of cancer, increases weight gain, leads to kidney disease and or kidney failure, and you won't even know it because there's no pain for that, and can damage the heart, the eyes, and the brain. Other than that, you'll be okay. Now, what we want to do is we want to get in there and we want to change this. You have a great chance in most cases, I'm not saying all cases, but most cases, you have a great chance of changing that, and we do that in our office all the time. All right, I'll see you on the next video.